Good afternoon. My name is Dr. Janessa Kilgore-Bowling, and I am the director of the social work program here at the University of Pikeville. Without dating myself, I've been a helping professional for about 18 years, and 15 of those years I've been a licensed social worker. About the last 12 or so of those years I've been a social work educator. So I can tell you, as a practicing professional, I have seen what this program or what this problem can do to families, to individuals, but as an educator, I can also see how we can make a difference. So I'm really excited to be moderating this panel where these individuals will be talking to you about some of the most fascinating and innovative solutions that have been implemented in our state on both a micro and a macro level. First of all, I'm going to introduce you to them, and then we'll go ahead and get started. Captain Jennifer Sandlin began her career in law enforcement with the Kentucky State Police in 2003. She was assigned to Post 9 Pikeville upon graduation of cadet class number 81. She transferred to her home post in Hazard in 2006. In 2010, she promoted to sergeant and returned to Post 9. She served as both a uniformed squad sergeant and detective sergeant before promoting to lieutenant in 2013. That's a mouthful. That's a lot to say. She remained at Pikeville Post as the investigations lieutenant. She became the operations lieutenant in September 2015. On September 1st, 2016, she was promoted to captain and assigned to Post 9 as the commander. On August the 1st, 2017, Captain Sandlin returned to Hazard as commander, where she is currently serving. Captain Sandlin was awarded the Exceptional Valor Award in 2010 from the Kentucky Women's Law Enforcement Network, a citation for bravery from the Kentucky State Police in 2011, and Leadership Award in 2012 from Kentucky's Law Enforcement Network. She completed the KSP Legacy Leadership Class number 1 in 2015. In December 2017, Captain Sandlin graduated from the 270th session of the FBI National Academy in Quantico, Virginia. That's a lot. Thank you. Van Ingram is the executive director of the Kentucky Office of Drug Control Policy. Words are hard today. Mr. Ingram joined ODCP in November 2004, shortly after it was created, with the mission of coordinating Kentucky's substance abuse efforts in enforcement, treatment, prevention, and education. He served with the Maysville, Kentucky Police Department for more than 23 years, the last 6 of those as chief of police. He is a former president of the Kentucky Association of Chiefs of Police and was named the Kentucky Chief of the Year in 2001. Mr. Ingram is a former recipient of the Governor's Award for Outstanding Contribution to Law Enforcement, as well as the Melvin Shine Award for Distinguished Service to Kentucky Law Enforcement. Thank you. Charlotte Wethington is a retired elementary teacher of 30 years. After the death of her son Casey to a heroin overdose in 2002, she found herself teaching again. But this time it was about drugs and the disease of addiction. Ms. Wethington has devoted her life to advocacy for over 15 years and has founded and served on various boards, including People Advocating Recovery. Ms. Wethington helped to establish a grief support group and initiated Kentucky's Casey's Law, or also known as the Matthew Casey Wethington Act for Substance Abuse Intervention, which is an involuntary treatment act for those suffering from the disease of addiction. Ms. Wethington speaks at every opportunity she can to raise awareness about the disease and to inspire others to advocacy. And we're going to begin with Captain Sandlin.
She introduced me. I'm Captain Sandlin. I'm the post commander at Hazard Post. And I'm here to talk about the Angel Initiative, which is an initiative that was started by Kentucky State Police. It was actually launched September of last year. So I guess I'm kind of the oddball up here, or at this event altogether. But I also think that that's important because it's important that law enforcement and public health workers start coming together to attack this problem. This is actually the second event that involves public health officials that I've been to, and what we have found, or what I have found personally, is there's so many just compassionate people that are all working toward the same goal. There's brilliant people, there's forward-thinking people that are all starting to come together, and I think that that's why we're starting to be successful in dealing with addiction. When Commissioner Rick Sanders came into the Kentucky State Police, he started the Heroin Initiative. And the Heroin Initiative is not specific to heroin. That's just kind of what we were dealing with at the time and what we still are dealing with. But it can be applied to any drugs. It can be applied to methamphetamine, it can be to fentanyl, to cocaine, to any drug of abuse. And so we took a three-pronged approach. Obviously, we're still doing enforcement. We're a law enforcement agency. We're still going to, target drug traffickers, and we're also involved in prevention and education. We've always done those two things. We kind of reorganized how we were doing some of that, but those things are still there. But we were missing a component, and this is something that we're police officers. We're not experts in recovery. I'll be the first to tell you that, and I think that that's kind of obvious. But he brought in the Angel Initiative, and he also brought in us carrying Narcan. So those things kind of started working together. And I first had a conversation with him when I first promoted to captain in September of last year, and he started talking to me about the Angel Initiative. And at first I was skeptical. I was, and I'll be brutally honest with you about that, because one, I didn't know how to even organize that. And I was at Pilot Post at the time, and he said, we're gonna launch it at Pilot Post. You're gonna be the pilot post for this. And I was like, oh my God. Okay. Well, first off, I was on probation, so obviously, I was gonna do everything that I could to do it. But once I started looking into it, and I started talking to people in recovery, and I started talking to health officials, and I started talking to treatment directors, I really bought into this. And I think what we see in law enforcement, and I don't think this is unique to law enforcement. I think that when you're serving people in the health field too, you get compassion fatigue. That's something that we battle, and we get that a lot when we're dealing with addicts, because we're seeing people at their worst, especially in law enforcement. We're seeing what's going on in the community, and how that they're victimizing people in the community, and how they're tearing the families apart. But that doesn't mean that we shouldn't help them, and that's what the Angel Initiative is about. So we won't take credit because we didn't actually come up with this. We modeled it after Gloucester Police, and they started it in 2015. And so I quickly realized that I couldn't launch the Angel Initiative by myself. We were going to have some help. And so we partnered with Operation Unite when we piloted it at Pablo Post. We've had help from people all across this area. We just had a public forum to kind of see, what kind of feel people out to see if people would support it, because we had to have community support before we could launch it. And so in April of last year, we had one in Pikeville, and we had people from all different disciplines that showed up. We had treatment directors, we had people in recovery, we had Commonwealth attorneys, we had judges, people from the media, everybody come together and was there to support us. They also, gave us feedback because we hadn't actually launched it yet. We were just trying to see how we were going to get this started and kind of what the approach that we wanted to take on it. But as effective March 1st, 2018, it was launched statewide. So we've got 16 state police posts across the state. And so we weren't the first police agency to start it in Kentucky. There was actually 2 police departments. The thing with us is we reach across the state, so we're statewide. What we do is, it is voluntary, because we will get phone calls from people, from family members who are desperate, thinking that, we'll just come and pick someone up. force them into rehab. But we don't do that. They have to voluntarily come to post on their own. And we complete an intake with them. And that was something, something that I got my feet wet with that too, because I had to help develop that paperwork. And I was like, an intake? Are we like taking their blood pressure? Like getting their weight? I don't, but we made it through it, and we've got those forms. There are some automatic disqualifiers, and I'll talk about that later. And then we have to determine if they need to go to detox. And so we've got several treatment centers across the state that agreed to partner with us. So we go through that list, and we start contacting treatment centers to see if they've got availability to get that person placed. So the selling point with the Angel Initiative is we try to get them placed immediately that day. And we will transport the participants if they qualify to the treatment center. So there are a few automatic disqualifiers. If someone has an active arrest warrant, if they're a registered sex offender, if they have 3 or more drug-related felony convictions as an adult offender, if we have reason to believe that they may harm an Angel volunteer, obviously if someone needs medical attention, we'll deal with that. And then the last one is if they're under 18 and they don't have consent of a parent or a guardian. So here's some statistics for you. We launched it statewide in April, but I actually took the first participant in September of last year at Hazard Post. So to date, we have taken in 53 participants across the state. We didn't have any idea going into this how many to expect. I think that's probably about where we thought that we were going to be. But I think as we get the word out and we advertise more, I think that we definitely are going to see an increase. So 41% of the people that came to us had already been to treatment prior. We do ask them about if they've been to treatment before and what kind, but that doesn't disqualify them from us taking them if they have been before. Not really surprisingly, they self-report on drugs of abuse as methamphetamine, alcohol, marijuana, and opiates. 69% are male, 31% are female. September we had 4, and to date in October, so far we have had 5. So we're averaging anywhere from 3 to 4 a month, which October, we've already surpassed that. Like I said, I've learned a lot from doing this, and what I've learned is this really is about the state police forging relationships within the community to address addiction. And it's also about saving lives. Obviously, that's what we're here. We want to reduce the number of overdoses that we're having. And so everybody has a part to play in that. Whether you are in the health field, whether you're in law enforcement, whether you're a teacher, whether you're a middle school student, everybody here has a part to play in this. And don't think because of whatever it is that you do in your community that you can't help, because you can. And it's important that we all are coming together. And I think that's been the common thing with everybody that's up here is this is about us coming together and not just talking about the problem, because we've talked about it long enough. We know that it is a problem. It's about talking about solutions. And so I'm grateful that I was asked to come here, and we're going to have a chance to have some, take some questions later. And I'll be hanging around here the rest of the evening, so if you've got any questions about the Angel Initiative, feel free to contact me.
Well, good afternoon. Good to be with you all today. I see we are the only thing between you and the door. That's the coveted spot every speaker wants. Thank you, Jenna. I knew we were friends. You take care of me. Thank you. Good to be in Pikeville. We were in Whitesburg yesterday. saw the great work that's going on there with Dr. Breeding's clinic. Spent the day in Pikeville, love Pikeville. But I got to go to D.C. tomorrow, and boy, I hate that. That is one crazy town. I was there last month, and there's a lot of homeless there. And I had some time after my speaking, and before I had to catch a flight, because it's a great walking city, you know. So I was just walking around town, and I see this poor old fella, and he's got him a stick and a string, and he's put a safety pin on it. He's holding it over a mud hole, and he's just acting like he's fishing. I thought, this poor man doesn't have a clue. Maybe there's something I could do for him. Well, he was right in front of the bar. So I said, hey, buddy, if you want to quit your fishing for a minute, come in this bar, I'll buy you a beer. He set his pole down. I walked over to the bar, got a couple of beers, brought it back to the table where he's sitting. I said, tell me, have you caught anything? He said, yep. I said, how many? He said, well, with you, it'll make 6. So that's why I'm glad to be in Pikeville, because I don't belong up there. So this is about innovative solutions, this panel, and you've heard an awful lot about it if you've listened to the things that have been talked about today. Kentucky is on the move. I've had the pleasure of serving 3 governors, and I've never seen us working better together than we are right now. Public health, behavioral health, Medicaid, state police, Department of Corrections, Inspector General. We are all together all the time. It's ridiculous. Because we're all pulling in the same direction. And we're all making sure we all have little pots of money, and we make sure every dollar we spend complements the dollar from another cabinet or from another agency. There's a sense of urgency that's never been there before. I tell you, I get tired. I've been doing this a long time. I remember 2005 helping to open a jail treatment program in the Pike County Jail. And I sat down with the 11 men that were in that program and asked them what their drug of choice was. And 10 out of the 11 said OxyContin. And here we are some 13 years later, and we're still fighting this battle. A lot of young people in the room, and I want you to understand, you're sitting in ground zero of this epidemic. You heard about it in New Hampshire, you heard about it in other places. Long before it was a problem there, it was a problem in Central Appalachia. When I do my presentations, I have a map from 1998 to 2000. Where were the 10 most places by zip code with the highest prescription painkillers per capita? One was in Northern California, one was in Central Florida, the other 8 were in Kentucky and West Virginia. Draw a line from Portsmouth, Ohio to Wise, Virginia, and you have the epidemic. Pretty much US 23 out in either direction, 50 miles east or west, and you have where this all started at. And it's not by happenstance. When Purdue Pharma set out on their multi-million-dollar campaign to have their drug prescribed widely across this country, they focused a tremendous amount of resources in Eastern Kentucky. Went from physician to physician, telling their lies about how their drug wasn't addictive, that it wouldn't hurt people, that people couldn't get addicted if they were in real pain, and on and on and on, all the trash they told. And there were a lot of people in this region with a lot of pain. A lot of coal miners have been injured. A lot of loggers have been injured. A lot of people who've done farm work have been injured. And so, yeah, this is ground zero. But it's also ground zero for a lot of good ideas that have gone forward in trying to address this epidemic. So I want to talk to you just a few minutes, kind of reiterating some things that have already been said on what your state's doing. The call center is a dream I've had for so long, that we could call one place and they would recommend everything from faith-based medication and everything in between based on that's right for that patient. A place that would be non-biased, a call center that would not try to tell people, oh, this is what you need because this is what we do. No. I wanted a place where you could hear the compassion as she spoke earlier of the way those ladies feel about their jobs. I'm so proud of them and what they've accomplished. FindHelpNowKY.org, the Kentucky Injury Prevention Research Center, set out to win a grant from the Center for Disease Control because they were hearing from physicians. We're out there telling physicians, oh, we want you to do this thing called SBIRT. It's a screening and brief intervention to treatment. And physicians are saying, I don't know where to refer them if I find out they do have an addiction. I don't know what to do with them. So we thought, we put our heads together and we came up with this idea for this website. We have nearly 600 providers on there now that go on there on a regular basis and update their availability. Before, we would expect people that are in an active addiction now, we expect them to call 41 centers around the country, around the state that accept Medicaid and figure out who's got a bed open today. If you're in active addiction, how long do you think that's going to last? By about the third call, I'm so frustrated, I'm just going to go back to what I was doing before. Dr. Brenzel talked about treatment on demand. These are two of the things we have in place to work towards that goal of treatment on demand. Because and one somebody else, I think it was Dr. Breeding, so everybody's going to have that moment of clarity. That moment they say, I can't live like this anymore. I just can't do it. And maybe they're going to jump off a bridge, but maybe they'll pick up the phone and call 8338-KY-HELP. Or maybe they'll go to that website and see, oh, there are places available, and they do take my Medicaid. So that's why we're trying to get closer to treatment on demand. We're trying to remove barriers. Dr. Brenzel mentioned the prior authorization for medication-assisted treatment is going to go away. We're having discussions with managed care for other barriers, for prior authorizations that aren't necessary. Just delay the process. We've got to be able to get people, when they have that moment of clarity, we get services to offer. Also, on our 1115 waiver for Medicaid, there's this archaic rule called the Imd Exclusion. And it was developed to keep states from dumping all of their mental health patients into a facility. And so they had a 16-bed limit on how many you could put in a facility. Well, that, for whatever reason, that carried over to substance use. And so a place like Appalachian Regional Care, or Addiction Recovery Care, excuse me, has to cap off at 16 beds. Well, that doesn't make any sense. I've been to their facilities. They can handle more than 16 per facility. So that's going to be removed later or early next year. The cap now will be around 198. But here's what the kicker is. We're not removing the cap for everybody. We're only removing for the cap for those places that can demonstrate we offer a full continuum of services. We take care of people. We take care of people while they're in here. We have a plan for them when they leave, and we have services to offer them after that. It's not just about improving access to treatment. It's not just about removing barriers. It's about ensuring quality. We don't want facilities to come in here that are Medicaid factories and they know how to check every box, but they're not offering real treatment to people. We want to be the gold standard in Kentucky for offering quality care. And I think we're getting there. So, Senator McConnell alluded to two things that are really going to be on our list in the next couple of years. We've got the residential piece down. We're doing a pretty good job with aftercare. But we're sending back people to the same environment that caused them to use in the first place. If you complete a 28-day program and then you go through a phase 2 and you're at 60 or 90 days, and you go back to the exact same situation you left, where your significant other is using, your buddy down the street's using, everybody you know is involved in that line, What are your odds of making it? Not very good. If tomorrow doesn't look any better than yesterday looked, and I have the same living situation, I have the same no job I had before I went into treatment, we're not giving folks a chance for success. So we're going to be looking a lot at transitional housing, and we're going to be working with a lot of organizations to provide that, and that's not enough. We got to be able to help people find meaningful work. I can't show you any data that says a person will do better in recovery if they get to meaningful employment, but I believe it in my heart that if people have a better shot at a job, at a good job, and can get back that part of their life, that their odds of success are greatly increased. So we're going to be working a lot with that. Addiction Recovery Care and Isaiah House, two of our behavioral health service organizations here in Kentucky, have done an amazing job at that. We just got to figure out how to take the good work that they've done and make it happen across our treatment systems. That becomes the standard, that becomes the norm, not the anomaly. We're looking in Medicaid at bundled payments. So right now, if a provider is doing medication-assisted treatment, they bill for the doctor's visit, then they bill separately for a group counseling visit, then they bill separately for an individual counseling visit, then they bill separately for targeted case management. What if we just give you a sum of money and you just take care of the patient? And you don't have to worry with all this coding and all this billing and making sure you get everything coded just right and in just the right words that the managed care organization will accept. What if we just pay you $1,300 a month to take care of this patient? Give them what they need. Again, trying to remove barriers, trying to get to treatment on demand. For the first time next year, for the first time, Kentucky's going to start covering methadone under Medicaid. For years, our patient load was consistent at about 3,000 patients on methadone. In the last 2 years, it's exploded to almost 9,000. You heard Dr. Brenzel explain this is a therapy that's proven to work, has years of evidence behind it, that it can really save lives and really help people be productive. It's ridiculous that we've never paid for it. This administration said move forward, figure it out. We need to cover it. So that's what we're going to do. How am I doing on time there in the back? Okay. We've been meeting with the Chamber of Commerce, and we've met with some of Kentucky's largest business leaders to figure out how can we create linkages between treatment and jobs. So one of the things that we're going to do in the coming months is we're going to use some funds that I've got from tobacco settlement to have we have 14 of our career centers around the state. We want to get it one person at least at each career center who their only job is to work with folks in recovery trying to find work. So that person will go out in that community, find recovery-friendly employers, then they're going to go and they're going to talk to the treatment systems in their community. When you have people that need a job, send them to us. We're going to hook them up with a job. Amazon, GE, some major folks, UPS, are committed to helping with this. And our Kentucky Chamber of Commerce have agreed to hire one person just to coordinate this from their side. So people that you wouldn't believe ever would have recognized this are stepping up. And I know that you students have been called on to step up too, so I'm going to make that same plea to you. We need you. We need every one of you to get waivered. We need every one of you to understand this disease. And we need every one of you to help us. The peer support specialists in the room, we need more of you. We need Tim Robinson to stop hiring them all. We need them other places too. But we got to beef up our peer support specialists. We have to beef up our ability to treat this in primary care. We got to incentivize people who are doing it right, and then disincentivize the folks that aren't doing it right. And so that's going to be my pledge to you. That's what we're trying to do as a state. We're going to continue to keep working these same programs. We're going to continue to remove barriers. Because look, we passed lots of laws. We went, our biggest year in Kentucky was 2011. We dispensed 371 million dosage units of opioids in a state of 4 million people. And that did not include buprenorphine. Now, 5 years later to 2017, we dispensed 284 million, nearly 100 million less dosage units on the street. So House Bill 1 that we passed in 2012 that was aimed at doing that worked. It did its job. That does nothing for everybody who already had a substance use disorder. Didn't help them one bit. You've heard talk about prevention. The reason we passed that bill, the reason we passed the 3-day prescribing limit in 2017, we're trying to keep the next generation from developing opioid use disorder. For all the folks that already have it, we got 2 things to help them with. Narcan to keep them alive, and treatment and recovery to keep to get them hope and get them help. That's all we got. And we can't do it as a state alone. We got to have lots and lots of partners. And I'm glad to see there's people like Dr. Breeding that are willing to step up and treat the whole person. We just need about 118 more to go around the state, like clinics like yours, and we'll get there. But I'm going to hang around for a while as well. This has been a great day. I mentioned I get tired. I've been doing this a long time. But then I hear Kayla's story, and then I hear Rebecca's story and Chase's story, and I have to hear those every week. And they say, Van, get back to work. Don't get tired. People are getting better. People are recovering. Let's just stay on the right course. So I appreciate just being here from a spectator all day, because it helps get me charged up and ready to go tomorrow. Thank you.
Well, I'm going to stand here with all my notes and try to stay on time, which is going to be a real challenge for me. I usually speak for about 45 minutes to an hour, but breathe easy, it's not going to be that long today. And you know, it may sound like I'm Debbie Downer here when I start to tell you a little bit about why we have Casey's Law, because I think it's important to know why it came about. You know, what inspired me to go to the legislature and try to get a law like this passed. But first I want to say I'm so honored to be here. I just appreciate it so much being asked to be with you today. You know, we never thought that addiction was going to come to our house, and we surely did not know what to do with it when it did. We know a lot more now than we did then, but we still have a question that will probably go unanswered forever, and that is, how did we go from this to this? How did we go from having a happy, healthy baby to burying that baby at 23 to a heroin overdose? It's something that I have tried to grapple with for 16 years now. I get through it, I'll never be over it. You know, and I think sometimes we forget that the casualty is not just the person who passed away. It's not just the person we lost. It's all the people who love and care about that person, because they've lost too. And they'll never be the same. There'll always be that void. You know, there's a lot of reasons why we didn't think that addiction would ever come to our house. Because Casey was a good person, because he was raised in a 2-parent family. He went to church and Sunday school. He knew about the dangers of drugs. He didn't see drug use or misuse in our home. And for all those reasons and more, we never thought that addiction would come to our house. it was those other people. Have you ever heard about those people? Those other people. So I said to my husband at one point, I said, do you think, or excuse me, notice how I framed this. You don't think that Casey is using drugs, do you? He didn't disappoint me with his answer. Of course, he said no. Denial is powerful because you don't even notice that I'm lying to ourselves. But you know, there was something inside me. I call it my gut feeling. I just had a gut feeling that something just wasn't right. Couldn't put my finger on it, but I knew it was there. And I should have listened to it. I didn't trust myself. You know, I take hundreds, and I mean that literally, hundreds of calls from parents and emails and text messages and messenger and all of it. And they'll say, well, what should I do? What should I do? What would you do? And I tell them the only piece of advice that I would give them, I'll give you options, but the only advice I would give you would be, if you think that there's something wrong, there probably is. Act now. Don't wait. So when addiction came to our house, I did what I thought I should do as a mother, because when do your children stop being your children? When? Never. So as I had always done when Casey, I felt like he was sick and needed help, I went to those individuals that I thought could help me. The first being my doctor. When I went to my doctor, I was wished good luck. When I went back to tell the doctor what had happened to Casey, she said, "You're kidding." I said, "No, I am not kidding." When I showed her a brochure about a conference that I was going to be attending in Lexington, I said, "Do you ever go to these conferences?" And she said, "No, we usually farm those people out." I didn't know that you farmed people. One of the counselors that I sought help from said that he thought that Casey was a risk taker, but he didn't think he would ever go over the edge. I wanted to believe that. You know, here I'm still in denial here. Another counselor said, "I think he's just a young man trying to find himself." Believe it or not, that same counselor, several years down the road after Casey passed away, called me to ask me for help for someone that was addicted. Another counselor was supposed to help us with an intervention. I didn't know anything about an intervention, didn't know what to expect, but I did what he advised me to do. At the planning meeting for that intervention, he said, "I don't think he's as addicted as he wants us to believe." He had never met my son. I guess I thought I was going to get Casey into treatment by osmosis. I don't know. I just was grasping at straws. And then there was the ER nurse that was with him, his second overdose. And when we got there, she was on the floor kneeling down in front of him, talking to him about the 2 A's in her life. Finally, she looked up at me and she said, "Honey, he's still too young. He hasn't lost enough yet." And I looked at her, and I didn't know how prophetic the words were going to be at the time, but I said, "What if he doesn't live to be old?" He didn't. Even though I knew that Casey was a risk taker, and he had the genetics, because on both sides of our family, excuse me, we had drug misuse on both sides of our family. My papa, as I called him, My mom never wanted me to say that he was an alcoholic, but he was a functional alcoholic. So he had the genetics, and then there was the affordability, availability, and accessibility of drugs. And I was clueless. Because you see, I lived in a box. And in that box was my family, my home, my school, my church. And I was very happy there. But then addiction came to our house. Casey knew that I was living in La La Land because he even said to me one day, he said, "Mom, where do you live? Where do you live?" I was living in a place that I wanted it to be, not where it was. So by the time that Casey admitted that he had a problem and needed help, he was well into his addiction. However, I believe that we could still get him help as we had before when he was sick, and that it would be just as available, accessible, and affordable as those drugs had been. But that was not to be the case. But you see, I was under that delusion because I had been going to my 12-step meetings. I'd been going to Nar-Anon and Al-Anon, and we were reading every meeting how addiction is a disease much like cancer and diabetes. So I thought, okay, well, we'll get him help as if he had cancer or diabetes. But what I soon learned was that Casey had a socially unacceptable disease, not an acceptable one. My husband has an acceptable one. And as soon as he was diagnosed with multiple myeloma, he was with the best doctors. He had a stem cell transplant, an autologous transplant, and he was a new man in 6 months. When we found out that Casey was addicted, we were burying him in 6 months. Casey did ask for help on one occasion, and we got him the help. We took him to a detox center. Well, and they had treatment there too, but he only stayed long enough for detox. And while we were there one evening visiting with him, a man came in who had befriended Casey, and he said, "Casey's making noises like he wants to leave. Let's do an intervention." I said, "Okay." He said, "Let's go down to the nurses' station and we'll ask them to do an intervention." So I trot along behind him, not knowing really what was all going to happen. We get down there, and the nurses who were sitting behind the counter, the first thing they did was push themselves back from the desk. Then they folded their arms and said, "If he doesn't want to stay, it won't do any good." He didn't stay. He left. You know, I think one of the things that we forget to say a lot, and I do think we need to say it a lot, is that this is a treatable illness. It's treatable. That's a message that I hope that you will go forth and carry. This is a treatable illness. I remember when cancer was whispered, it was the C word. No one talked about it. But now, since it is talked about, we have more research and we have more funding and we have more people living with cancer than dying from cancer. I want to see that for addiction. I love this quote by Dr. Tom McClellan. He was at one point the deputy director of the ONDCP. And he challenges us to think about this. Imagine if we began to treat diabetes in a system such as we have designed for addiction. Can you imagine that? Just a moment, imagine that. We faced all kinds of barriers with Casey. And I am so glad to hear today that some of those barriers are being broken down. I am so encouraged. I am so glad to be here today. But that was not true for us. But remember, this was, and maybe I haven't said that, so you can't remember, I haven't told you yet. But Casey passed away in 2002. 2002. That was before we were hearing heroin. It wasn't the household word. It was before we were hearing the word addiction. You know, I felt so ignorant as a teacher, as an educator, that addiction wasn't even in my vocabulary. You know, we said, Papa drank too much. We never used the word addicted. And actually, I taught for 27 years. You gave me an extra 3. I felt like I taught for 30, let's just say that. But anyway, the barriers that we faced, one of the main barriers that we faced was Casey's age. He was over the age of 18. And so we were told that we could not intervene on him, that we were trying to take his rights away from him, that he had the right to choose, to make that choice. You know, it just didn't make any sense to me how that someone is, just like Van alluded to a few minutes ago, that someone whose brain has been distorted and damaged can make rational decisions about themselves and their health care. So, you know, we faced a lot of misinformation as well as a lack of information. But regardless of who we talked to, it didn't matter if it was a lay person, if it was a professional, if it was a person in the program. The message that I got every single time I asked for help was that Casey had to want to, lose enough, and hit bottom. I was depending on other people to inform me as the best direction to go with Casey. And so we were waiting for all of that to happen. We were waiting for him to want to. And we waited until he asked for help and only stayed for 6 days of detox. We waited until he hit bottom or lost enough, or hit bottom, and died after the 3rd and final overdose. And then we waited until he lost enough, and we buried him on August the 22nd of 2002. When I talk about the bottom line now, I say the bottom line is this: you have to be alive to recover. And if recovery is our goal, which I believe absolutely it is, then we have to do everything. We have to use, as someone said earlier, every tool in our toolbox to make that happen, as we would for anybody else who has a chronic illness. So we were not allowed to intervene until Casey's 3rd and final overdose, when he was lying in a coma. And then we were asked if we wanted to have a feeding tube put in, and of course we said yes. Did we want to have a cage put in his lung to capture any blood clots that might develop? Absolutely, we did. And then the final question was, did we want to turn off the life support? No, we did not. But at that point, it was over. There was not going to be any recovery for Casey. And if everybody was worried about his rights, I can guarantee you that he kept his rights all the way to the end, the dead end. And I know for a fact that the drugs took his rights away long before we ever thought about trying to intervene on him. So when Casey passed away, I looked at one of the nurses and I said, I can't go on. I can't do this. I didn't see how I was going to live. As you can see, somehow I have managed to do that. Casey was arrested one time right before his last overdose. He was arrested, and he was released on his own recognizance with the warning that he could receive a summons within 90 days to appear in court. With me, they are in court begging the bailiff to let me show the judge Casey's history as we knew it. And she said, well, we're not here to deal with that today. He's going to be released on his own recognizance. I shook those papers that I had in my hand and I said, I'm trying to save my son's life. Didn't make any difference. So when Casey died, and I was able to somewhat function again, I called the court where Casey had been in Noblesville, Indiana. And the person who answered the phone, I said, well, I'm calling in regard to Matthew Casey Wethington. And she said, well, we have a warrant out for his arrest. I said, good luck. He's at Spring Grove Cemetery today. I told her what I had wanted the judge to do that day, and she said, well, you don't understand how the system works. And I thought to myself, oh yes, I understand all too well how the system doesn't work. And I said, I think at that moment in time, it was like my epiphany. I decided that maybe, just maybe, I could make a difference. And so, there was no law, and then Casey died. I had been in my 12-step meetings, and I had learned from a mom there that there was legislation in Florida, there was a law in Florida, that allowed families to intervene on their loved ones, regardless of age and without any criminal charges. Because it didn't take me long to figure out how people with addiction were being punished for having a disease. And I was not about to contribute to that. And so I went to my legislator, Tom Kerr, and I asked him if he would be willing to sponsor a bill that would allow the same thing in Kentucky. And he said he would. Now, the good thing about being able to reach out to Tom was because I had gone to Frankfurt as a teacher advocating for funding for education. So I already had a relationship with him. On a first name basis, I could call him up and ask him to do this for us. Because I knew that Casey wasn't the first person that overdosed, and I knew he wasn't going to be the last, and that there were going to be families coming behind us who were going to be just as desperate for help as we were. And so he was willing to do it and took it to the legislature in 2003. Now, Casey died in August the 19th of 2002. And by, I'm saying probably October or November, I was on the phone with Tom. One thing I would encourage you to do, you young people, get acquainted with your senators and representatives. Let them know who you are and what's important to you. Because then that way, when you need something done in the legislature, you have already built that relationship. That's something you can do today. Be involved. And so we went to the legislature with it in 2003. It didn't pass, but he was willing in 2004 to take it back. Whoops, went the wrong way, didn't I? Oh, okay. So now we have the Matthew Casey Wethington Act for Substance Abuse Intervention. You know, the biggest regret that I have about Casey's law, I do have a regret. That's probably my only regret. I mean, there's things now that I might tweak a little bit, but basically I'm very happy with the way the law turned out. But the one thing that I regret I use the word abuse in the title. One thing that we haven't heard a whole lot about today is the language of recovery. We have a lot of stigmatizing language out there that does nothing but continue to stigmatize the disease. So I hope that that is one thing too, that we will all start using the language of recovery, and that we will start using that people first language so that they cease to be addicts and become people with the disease of addiction. Because as the young man said that was talking about his father, and I'm sorry, your name was no, not Adam. Jason, I'm sorry, I couldn't remember your name. You know, that his dad was so much more than his addiction. And I heard someone say today that these are good people. Absolutely, they are good people with a bad disease. And it's time that we stop stigmatizing them. Out on the table, there are brochures about Casey's Law. And I don't know where I am on time, Jenna. I'm talking away here, and if I need to halt, just get the hook out. 2 minutes? Okay. Well, I wanted to spend a little bit more time on the process of Casey's Law, but just briefly, and I will tell you this. I work with other advocates in northern Kentucky, and we travel around all over the state. I would be happy to come back. I would be happy to do a class. I would be happy to do we would be happy to do a training on Casey's Law that would go into more depth than I can go into today. But in the brochure are the steps in the process. And just in brief, what it does is it allows parents, relatives, and or friends to petition the court on behalf of someone who has a substance use disorder, regardless of age, without any criminal charges. No criminal charges. This is not a criminal case. I wish that I had not had to involve the court at all, but there had to be what I call the hammer in Casey's Law, so that the person knew that they had to comply with what the court was ordering for them to do. So if during the process that person is non-compliant with any step in the process, they can be found in contempt and taken to jail, but, and here's the big but I hope that you will hear, only until they've got their evaluations done or until they have completed that treatment plan. So it's not meant for punishment, it's meant to keep that person safe, hopefully, until they can get back into their program. Once that they have, they schedule appointments first, the petitioner does, schedule appointments. One has to be with a doctor, I would have loved for it to have been an addictionologist. We don't have enough in the state to make it feasible for that to happen. The other one, a qualified health professional, counselor, therapist, certified alcohol and drug counselor. Once you have those evaluations scheduled, then file the petition with the circuit clerk, and the petition and the evaluation forms can be found on Casey's website, which is on this brochure. It's just caseyslaw.org. Once the evaluations, the petitioner needs to go with that person to the evaluations. They need to be notarized and back to the court no later than 24 hours prior to the court date. When the petition is filed, the court date will be set, and it has to be within 14 days. During that time, that's when the petitioner, while they're waiting for the court date, finds a treatment facility for the person to go to. That gives that person leverage as far as if they're going to have to pay for treatment, or if if they can find treatment that is at no cost. We have 18 Recovery Kentucky centers in the state, $0. $0. So that is a great benefit to people who cannot afford treatment. And then I was so happy to hear Dr. Brenzel say treatment on demand. They show up, they need treatment, it's done. So that's going to be a great help to everybody. And then the judge, in looking at the petition and reviewing the evaluations, can order treatment for up to 360 days. I know that there are people today who are living in recovery, in part because of Casey's Law. If you want to see what I consider, of course I'm prejudiced, a great video made possible by Van Ingram, the Kentucky ASAP funding, and with the support of Northern Kentucky Hates Heroin, we have a video. It's called, you can find it on YouTube, Casey's Law, Speaking Hope for Recovery. So even though I started out telling you all the bad stuff that happened to us, what I know for a fact is there's hope in recovery. One of the things that has touched me the most is that two of the people that were in that video just had a baby. Each one of them was petitioned under Casey's Law to go to treatment twice. Because of what Casey's Law meant in their life, has allowed them to be married and have this beautiful baby. They named their son Jackson Casey. That's just one story. There are many others. We were able to feature about 10 stories on the video. But I am so grateful to Casey. For helping me to be a more compassionate person, for giving me a purpose to go on living. And, you know, I feel like I had 3 things going for me. I had passion, purpose, and I'm real persistent. My husband has said to me many times, quit beating a dead horse, Charlotte. But I will beat that I'll beat that drum forever. You know, advocacy, as I was telling Janessa, I believe advocacy is where it's at. Because advocates can do things that people who are under the constraints maybe of their agencies or organizations cannot do. We have, I believe, a real untapped resource. And that resource is our families who have been touched by this disease. Because they have the passion and they'll have a purpose. And with some persistence, they can do great things. Thank you very much.
Jenna, do we have time to engage with a couple of questions? Okay. You'll give me the hook? Okay, all right. I just wanted to ask a couple of questions for all of our panelists, and one of those is thinking about the changes that we have seen in the last 10 or 20 years. How do you think we need to be, how do we need to adjust our priorities and our response to make sure that everybody has access to treatment and the care that they need? And I should probably give you mic so you can talk to me, shouldn't I?
One of the things that we've set aside $500,000 of some money we've gotten recently to hire someone and then go out and deliver content on reducing stigma. I think a lot of people give up on treatment because they just don't think they're worth it. And they don't think there's any help or hope. And I get a chance every week to meet somebody new in recovery and I get to hear their story. Most people don't get that chance. And So I think we've got the resources in place. We've got more treatment in Kentucky than we've ever had, and everything under the sun. But we still got medical providers like Charlotte talked about that don't understand this disease. And we've got families that don't understand it for sure. And we got people that don't understand their own disease and that they can recover and they can do better. So that's some of the things we've got to work on, is restoring hope and helping people understand this disease and the pathways to recovery.
Awesome. Do you guys, anybody have anything else with that?
I would just say, I mean, I know this sounds pretty strong, but I think stigma is almost as dangerous as the drugs themselves.
Yeah.
I really do. Stigma is killing people.
Yeah.
It's keeping keeping it a secret, and that secrets can kill people.
Yeah. Thank you. Another question, this one is actually for you, Captain Sandlin, if that's okay. You and I talked a little bit earlier, and I told you I was a little embarrassed that as a helping professional, I didn't have a great deal of knowledge about the Angel Initiative. And one of the things as I was listening to you talk that popped into my brain was, how have you worked to build the trust of people who are suffering from addiction, or how has the initiative worked to build the trust of people who are suffering from addiction, to be able to say, you know, you're not under threat of being arrested. We are truly here to help, given that there is that stereotype in the community that it's law enforcement, not law helping.
I mean, just promoting it, you know, I tell my troopers, I'm like, you know, if you find someone, it's not an alternative to going to jail. You know, if somebody's committed a criminal act, then, you know, we still take the appropriate response, because that's what we're required to do. But they can have those conversations, because a lot of times their interaction with people, we don't arrest them. Majority of the time we don't make an arrest. And being addicted is not criminal. In and of itself, it is not criminal. And it can lead to criminal behavior. It doesn't always, but it does at times. And so we're trying to capture those people that, you know, especially with the Angel Initiative, that have not fallen into the criminal activity yet. They're not in the criminal justice system. You know, we're trying to get them early on and get them into recovery before, you know, we are taking them to jail and they're going down that path. And so a lot of it is just conversation, just going out into coalitions. It's, you know, letting people know that we are here to help, because that's why we go into law enforcement, is to help people. It's not to arrest people. It's not to take people to jail. It's to help people. And, you know, unfortunately, sometimes it requires us to take people to jail. But this is just you know, I'm so proud of the agency for taking this initiative on, because, you know, it really gives us that opportunity to help people get into recovery that we didn't have before. And, you know, instead of, you know, just our idea of recovery before was taking them to jail, because, you know, I'll take you to jail and you can dry out there. Maybe they can get you in a drug court or something. So this is a better avenue for us. It doesn't work for everybody. It's not going to, but it's another option, because that's really how we're going to attack this, is just having different options for people, because not one thing's going to work for every person. And, you know, I really was surprised at the amount of people that have come into post to go to the Angel Initiative. And I've transported several of them myself, and, you know, I have those conversations with them. They're like, "You're so nice to me," and I'm like, and you know, it's that mutual respect that we have with the participants, and it's really been a great opportunity and a learning experience for me.
You have something?
Just talking about reducing stigma, the fact that the Commissioner of the State Police and his captains and troopers and all around the state are saying, "Come to us, we'll help you," can do as much to reduce stigma.
Absolutely.
And I'm so proud of the agency and so proud of the way they've taken this on, because the lead law enforcement agency in the state says, "You're worth it, come on, we're going to take care of you."
Yeah.
It says a lot.
It does. You're right. In your individual roles and your experience as a law enforcement officer, as an advocate, as someone who works in policy, what are some of the ways that we can improve our collaboration and our communication between the healthcare system and in the sectors that you work in to just be more effective in our approach to addressing the problem?
We've gotten pretty good, as I mentioned, within state government of collaboration. One of the things Dr. Brenzel and I have been doing recently is going out and meeting with hospital systems and trying to get the leadership of hospital systems and the Kentucky Hospital Association to partner with us. You know, I've been in law enforcement since 1980. We've been diagnosing the disease of addiction in the criminal justice system for 40 years. We're frankly not very good at it. We think everybody needs to go to a residential program for a year. That's the way the court has responded over the years. We need to be identifying addiction long before it ever gets to criminal justice. We need public health and primary care, and everyone who touches a patient along their path be helping to identify this problem long before they get to the criminal justice system. And we're getting closer. We're getting better, but we still got a long way to go.
Well, I loved what Dr. Breeding said. Oh my gosh, I'm gonna have to shake his hand before I leave today, because what better person to instill in people that addiction is a disease than a doctor, really. So, and in real estate they say location, location, location. Well, in addiction, we need education, education, education. The more people understand it, the better relationships are going to be, I think. So, and just, about the law enforcement, I just wanted to touch back on that just for a second. Casey's Law was meant to be for people before they got a felony. But that doesn't mean you can't file if they have a felony that's already been dealt with. And so, I just lost my train of thought. I was trying to hurry.
It's okay. Words are hard today. I think I said that earlier.
I know. I don't know. I can't think what I was going to say now about that. Oh, I do know. Recovery, I was talking with someone earlier today that is a person in recovery, and I was sharing with her a conversation I had had with other people in recovery yesterday about how recovery is hard work. It's hard work. It's not a piece of cake. And so, we don't want to add one more barrier to their recovery. And that's what a felony conviction does. It adds one more thing. And it's not just one felony, because when they get on that trajectory, it's 2 felonies, 5 felonies. So, it's so important to intervene early on. So the Angel Initiative is a great program. Sorry.
I think it's important for us to share data. We've actually started doing that. Law enforcement before were kind of like, this is theirs and you can't have it. But we have started doing that with KIPRIC. We give them arrest data, collision data, and then they make these big fancy maps and they overlay them, and they can create hotspots based on overdose death rates from emergency rooms, and along with their arrest data. And so that's been great information that we're getting back from them on that.
Thank you. Yeah, go ahead.
One more
Go
thing.
ahead. Go ahead.
One more thing. When I went to, you triggered something, started saying when you said that about data. They said when I went to Frankfurt, I needed data, I needed statistics. Well, for heaven's sake, in 2002, are you kidding me? We're lucky to get it now. My gosh,
Right.
In 2002, it was unheard of. You know what I went with? I went with Casey's story. Never forget the power of stories. And if you have one, please tell it. Please share it. Because people need permission to talk about this, and you can give them that permission by sharing your story. I wear a bracelet, I have it on today with Casey's picture on it. People will see it and say, oh, I like your bracelet, and I'll say, that's my son Casey. He died from the disease of addiction. Now, maybe that's more than they want to hear, but I can tell you 9 times out of 10, they will then turn around and tell me their story. Why? Because I have made it safe. I have made it okay for them to tell me, because I'm not going to be judgmental. I'm going to be compassionate. I'm going to be understanding. It's going to be okay to talk.
I actually think that's a beautiful place for us to wrap up. I just want to say thank you. You guys are doing amazing work. As I was introducing you, I was thinking, wow, I really feel honored to stand among the leaders of the state in such greatness. Thank you so much for what you're doing, and thank you for your commitment to the people of Kentucky. Yeah.